Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
All right, Minister. Well, we know that in the Parliament this morning you spoke extensively about the Gene Expert machine. So we wanted to follow up, if you can indulge us. Kaitor News specifically had some questions. They wanted to know how many of those machines do we have in the country, and more specifically, they wanted an explanation as to how they're used.
So a Gene Expert machine is what is called a point-of-care PCR machine. So it's like the PCR that we will do, where we collect samples and then have to send it back to Georgetown for it to be analyzed. But instead of doing that, this machine would be at the hospital. We take the sample, we put it into the machine, and it would be able to process that sample within an hour. So you can get back the results in an hour. These machines can do large samples. So a machine in one run would be able to do like four tests. And so they're for smaller samples, but you're able to get it back within an hour. So it's similar to the PCR that we're doing in Georgetown. Only thing, it's being done on the spot, so to speak.
Okay.
And they're very specific and sensitive. So it's a really good setup to have.
All right. And how many do we have, and how many regions have they gone out to thus far?
We have 4 so far. We have placed 1 in Lethem. And they have already installed it. They're having training this week. And so I think yesterday they were running some test samples to make sure that everything is okay. And they have trained the staff who are going to be working on that machine. Next week they're going to go to Mabaruma. The machine is already in there. Staff has been identified, but they're going to go there now and do the follow-up training. We also have a machine in Region 10 at the Linden Regional Hospital. And again, we'll be sending a team to do the training there to make sure that they can deal with COVID-19 testing. And similarly, in New Amsterdam, we have a machine. So we'll be training the staff there as well, so that they can do these tests right on the spot.
Okay. And are we going to get more of those in the future? What is the cost like for those, though?
We have put in an order to buy some more.
Oh.
So I think there are 2 more that is coming. The cost, I don't have the price right now, but we have ordered 2 more.
And this, of course, adds to what we already have in place.
Right. So this, with the 2 additional ones that are coming, that would be 6, and then we're thinking about buying some more.
Okay.
So as you know, we have a World Bank project, and through that World Bank project, we had dedicated some funds to be able to procure Gene Expert machines.
Okay. All right, Minister, thank you so much.
And just to say that with these machines as well, we can repurpose them after we're done with COVID to do testing for other diseases. So that's why we want to acquire them now, place them in the region, train people to use them so that we can then do other types of testing with them as is necessary. So TB and malaria and all kinds of other things we can do.
Okay, great. We started our COVID-19 vaccine education segment, basically. So we had a few questions that we wanted to ask today. What are the possible side effects of a COVID vaccine? You had spoken to us before. Could you guide us through that a little bit?
So generally, the side effects that people would have from a vaccine can be grouped in 2 large categories. The first one is really like routine reactions, or what is now termed reactogenic, meaning that you are reacting to the vaccine. And these would include at the site where you got the needle stick, that some people can feel a little bit of irritation on the skin. Some people might get a little swelling. Some persons might get a little bit of redness. Some people might have a little bit of pain. Some people might have a little bit of fever. But these things go very quickly. And for most persons who have experienced getting a vaccine, most persons would not experience these things. So this is one type of reaction. The other main group of reaction is very, very rare, but sometimes they can occur. And depending on which vaccine is being used, different people might react in different ways. So this group is called adverse reactions, meaning that while it's rare, it can occur. Now, with the mRNA vaccines, that's the vaccines from Pfizer and Moderna, there has been published in the scientific literature that one of the rare events that you can have is something called an anaphylactic shock, meaning that after you get the injections, the injection maybe about within a half an hour, that person might react adversely to the injection, and therefore you would need to have certain other medicines to help that person. So one way of mitigating against that is that the medical team that is administering that injection would have the medicine on standby, and after you receive this vaccine, they would keep those persons at least for half an hour and observe them to make sure that they don't have any adverse reaction. And if by chance they have an adverse reaction, then the medicine is there to give them so that they would be okay. So that's how you deal with that. In some cases, again, with the mRNA vaccines, it has been reported that there have been an association with something called Bell's palsy. This is a paralysis of the face, but that's a temporary condition, and that would go after a couple of days. But these are the only two things that have come out in the literature, and as I said before, these are extremely rare events. So it's not something like everybody getting an injection, this would happen to them. These things are extremely rare, right? So for the millions of people who have received the vaccines, you probably had a few cases. But nevertheless, these things are published so that persons using these types of vaccines can be aware and know what to look for. We also, we have prepared a system that when we start our vaccination program, that we will be monitoring for adverse events, and we'll have a system whereby people can report these events, and we'll investigate each case of these events if they occur, right? So we have set up a committee, we have set up how we are going to be doing that and so forth.
And I know before the vaccine is administered, there will be checks and so on.
Oh yes, our staff has been trained, so they would talk to the persons who are coming for the vaccination, so persons can understand which vaccine they're getting, what are the possible side effects, if any, and also what would be important, because all these vaccines, you have to receive 2 doses. So you'll get your first dose, and then you'll get a date on your clinic card to tell you the next time you'll have to come back. So with some of the vaccines that are currently in use, people might have to come back after 3 weeks. In other cases, they probably will have to come back after 28 days.
Okay, all right. Our next question, is there anyone who should not get a COVID-19 vaccine?
So far, these vaccines, like the mRNA vaccines, have not been used in children under 16. And that's because when they were doing the clinical trials, they did not use children, so we don't know how it would work with children. The emergency use authorization that has been given in the United States and in other countries allow the vaccine to be used for 16 and older. And similarly, for the other types of vaccines, again, it's 18 years and over. So like AstraZeneca, the emergency use that has been given is for 18 years and over. Okay. The reason why so far they haven't done anything with children is because COVID-19 tend to be milder in children, and also, I guess, as they were rolling out these clinical trials, they want to focus more on the adult population. So none of the trials have really taken children and run the vaccine or the trials on children. Pfizer and Moderna, I think, has said they would be starting clinical trials to look at 15 to the, I think, 12 age group, and then another trial looking at from 12 maybe to 6 or something like that. Okay. But those trials are, I think, one of them might have started, and if it hasn't started, it'll probably start very soon. And so when those results are in, then we'll know what are the efficacy of these vaccines against the disease when children contract it.
All right, Minister Anthony, thank you so much for speaking with us.
Okay.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.